Stalker here from WestfordCAT, and I'm with Jeff Stevens, Westford's health director. And we are going, hi Jeff, good to see you. We're going to talk about the COVID-19 vaccine. There's a lot of confusion and misinformation out there about it. So why don't we just cut right to the chase, Jeff, and who is getting vaccinated and who can get vaccinated?
All right, so what is happening right now with vaccines is I certainly understand there's a lot of frustration with people wanting to get vaccine and not having the ability to do it quite yet. What the state has told us is phase 2 starts on Monday, which is February 1st. And anybody over the age of 75 is now eligible to get vaccinated, as well as everybody that was remaining in phase 1. Hopefully all of phase 1 is basically done so we can focus solely on the 75-year-old population. What we're doing in Westford is we're ordering vaccine Monday. We don't know how many we're going to get. The state has told us that sometimes allotments may be as few as 100, and there isn't much we can do about that. So we'll put our order in. Whatever we get, we will vaccinate as many people as we can per shipment. So there will be more than one vaccine clinic in Westford. It will take time to get it. And we have to remember that once you get one vaccine, you have to reschedule for a second vaccine, which will be 28 days later. We are assuming we are getting Moderna vaccine. We don't have the capability to store the Pfizer vaccine due to the temperature requirements of it. And hopefully in the near future, there will be another vaccine that comes online that's made by Johnson & Johnson that is a one-dose only vaccine. And that will certainly smooth out any clinics that anybody has. Now you get one and the cycle's completed. But until we get to that point, we are going to be focusing on the Moderna vaccine. And there are several sites across the state that you can get it. If you go to mass.gov and you look for where can I get my vaccine, you will find a location map. There are a number of stars on there, different colors. Red ones are general mass vaccination clinics for the public. Some are for individual towns only. Others are for whatever the town designates it as, and there's a link to register on those. Every single person that gets vaccinated will need to register for a clinic. You're not going to be able to walk in because every vaccine will be spoken for through a registration point. If you need help with registration, and there will be people that do, the Cameron Senior Center is willing to help. And Jennifer and her staff there are fully prepared to help anybody who needs to get registered. You will need your insurance card. If you don't have insurance, that doesn't mean you can't get vaccinated, but we're asking for the insurance card to make sure that we can get that information to the state and have them process it. The vaccine itself is free. There is no out-of-pocket expense whatsoever. And we're looking to get going. We're excited to get people vaccinated, but we understand it's a slow process. We're frustrated with it, and I know many other people are. As soon as we can get vaccine in people's arms, we'll do it. And just be patient. Take your time registering. If you don't get it in one day, try again the next. Eventually, we'll get it out to everybody.
Is there difficulty in registering, Jeff?
There are different degrees of difficulty. Some people are having difficulty because they don't work with computers that often. Mm-hmm. Other people are able to just go in and do it. The one thing that we've seen is anybody who doesn't have the ability to do it, the senior center's been really good at being able to either walk somebody through or tell somebody what they need to do or make that appointment for them. So it's really not that complex. I mean, I know my own parents who are 75 and 82 were able to register at a Gillette clinic, and they did it at their own free will and accord and were able to do that. And they're driving down, I believe, early next week. So it's a doable task, and it's it's going to be different than the flu shot. It's not going to be just show up and get one. It's going to be a process. You go in, you have to identify yourself. You have to fill out a form to make sure you're not allergic to any of the components in the vaccine. And additionally to that, once you get it, you need to sit for anywhere from 15 to 30 minutes to make sure you don't have an adverse reaction. The good news is, in the larger clinic that we did regionally for our first responders, we did around 700 doses for everybody at that clinic, and we did not have any adverse reactions on site. We did hear some people, we did hear that some people got some minor symptoms, flu-like symptoms for a day and they went away, but they were only a couple of people like that. So we are encouraging people to get it. It appears that it's very safe. And anybody who has questions, I'm more than happy to answer them if they want to call the office.
So the people that got the vaccine, the first responders and vaccine givers, I guess, for lack of a better word, they have to go back soon to get their second dose. Is it the same dose?
It is the exact same dose, the exact same dosage.
Great. Okay.
So it's going to be an identical process to what happened the first time. And that will be the same for anybody else who gets their first dose. You're going to go back in 28 days and you're going to go through the exact same process.
Now, when is the next phase after 75 and older? What comes next?
The next phase will be people age 65 with 2 comorbidities.
Okay.
And those are things such as cancer, diabetes, COPD,
high blood pressure,
heart and lung diseases, things like that. There is no required proof when we get to that phase. It's a self-attestation. Mm-hmm. So if you know that you have 2 or more comorbidities, you just need to identify that you have them, and that is the end of the proof that you will need. Nobody's going to ask for a medical record. Nobody's going to ask to see if you've been to the doctor.
Gotcha. Okay, so people go to mass.gov to register for the COVID-19 vaccine. Is there anything on the town website?
There is a link to that on the town website.
Okay.
And as soon as the town is able to put up clinics for ourselves, we will have a registration site on the town website. It'll be on the health department page, the COVID-19 page, and I'll have it on Facebook, and they'll have it at the senior center as well.
So you said you are getting the vaccines for Westford next week, or you're ordering them?
We are ordering vaccine next week.
On Monday.
And we are then at the mercy of the state on what we get for an allotment.
I gotcha. Okay. All right, Jeff. Well, thanks so much for the update. And you guys are doing a real good job over there. We appreciate everything you're doing. I know
All right, Patty.
I know it's not easy. All right. Stay safe, Jeff. We'll talk to you next week.
You too. Bye.
Bye. For WestfordCAT, I'm Patty Stalker.